Tonight, local law enforcement is reacting to a new push to solve the nation's opioid epidemic. President Trump declared a public health emergency.
But deaths are piling up, and the president's push has limited funds. News 6 investigator Adriana Ivashinsky found out for one local sheriff, this fight is personal.
Well, here at the Orange County Sheriff's Office, they tell me that 5 out of every 8 calls they receive is heroin or fentanyl related. In fact, they get 2 to 3 overdose calls that result in death every week. And that's not affecting just men and women, it's affecting children too.
We have seen a continuous increase this year. The number of overdoses that we are responding to in unincorporated Orange County are up by about 83%.
Sheriff Jerry Demings knows the far-reaching effects of the opioid crisis all too well. He says his brother was a heroin addict and died several years back. Now, as he watches what the president wants done to try to break the cycle of opioid addiction nationwide, he wants to know how it will really be applied. But he agrees with the president that the drug fentanyl should be outlawed.
We were able to outlaw fentanyl. It certainly would reduce the lethality of what we're seeing with overdoses.
Here in Central Florida, city and state leaders have been trying to get results in the fight against opioids for the past couple of years, with the creation of a task force and even giving officers Narcan to use in the field in an effort to save lives.
There's not a single family in Central Florida, I think, that either directly or indirectly isn't affected by this.
Over at the Children's Home Society of Florida, they see how the opioid crisis affects the entire family, especially the children. And they say the focus on telemedicine, as shown in this video, couldn't come at a better time, especially to those living in rural areas.
Obviously, more resources would be better, right? But I think opening up the door on some of the regulations, like telemedicine, will give us more ability to reach people that we haven't in the past.
And they started doing those telemedicine sessions over at CHS about a year ago, and they tell me that they really started noticing the opioid crisis peak about 3 or 4 years ago, and that's because they really saw an increase in the number of children going into foster care. Reporting in Orange County, Adriana Ivashinsky, News 6.
It is a huge, complex problem, and there are so many victims out there, family members.
Lots of layers.
Innocent people who are affected by this.
Yeah, it really is.